Art therapy is a HCPC recognised profession and operates under the guidelines of the British Association of Art Therapists. Art therapy has roots in the open studio style practice, being first established in the NHS in 1946, although it wasn't until 1981 that the profession was officially recognised in the health service. It's an extremely flexible therapeutic approach, which can be tailored specifically to the needs of the individual or of the group. It can vary in its forms, and these can include person-centered, psychoeducational, trauma-informed, and mentalization-based, among others. Visual art therapy is a form of psychotherapy that uses art materials and artwork such as painting, drawing, and sculpture as its primary mode of expression and communication. In art therapy, the client sets the pace and chooses what to make. There's no forced requirement to make any art, although it's actively encouraged. It's often mistaken as a recreational activity or an art lesson, and though a service user may acquire artistic skills, it's not the primary aim of art therapy. There is, however, an emphasis on creativity and the therapeutic relationship. While art therapy can be carried out in a one-to-one environment, it's often very effective in group settings too, especially when patients are dealing with similar issues. Mark making is fundamental in human development, and when words fail can provide an alternative means of communicating. In art psychotherapy, artworks can be used to create equivalents of past and/or internalized experiences using visual images instead of words. Within this process, the art materials and the images provide a means of expression, holding, and recognizing confused, difficult, and traumatic feelings. Symbolizing thoughts, feelings, and experiences can be a more effective means of expression and communication than verbal description, and can render these thoughts, feelings, and experiences less threatening. The art people make in art therapy can also start useful discussions and encourage self-reflection. In psychotherapy, all communication, both verbal and non-verbal, is two-way between the therapist and the client. However, in art psychotherapy, communication includes a third dimension, the actual artwork produced by the person. Art therapy isn't just about the finished art object, but everything that goes into it and is experienced through making it, as well as the relationships around it. The client's relationship to the art object, the therapist's relation to the art object, and the client-therapist relationship itself. The art therapy process can feel safer and less threatening and intense than experienced in a verbal communication style psychotherapy for some people. The existence of a picture as a separate entity means a therapist and client can relate to each other through looking at the image together, which can be a less threatening way to confront issues. The artwork produced is not used as a diagnostic tool, but as a medium to address emotional issues, which might be confusing and distressing. Art materials allow communication of thoughts and feelings that a person might feel difficult to put into words, and through their use they can encourage release in a safe and acceptable way. Art making can help us understand more of what's going on underneath, helping a person develop a better understanding of themselves and encourage insight into situations that are causing issues. Art therapy gives patients the opportunity to express themselves creatively and symbolically, and it can give them a sense of achievement, empowerment, and identity as someone who can create change in their immediate environment. It can promote emotional resilience, problem-solving skills, and coping techniques. Also, the sounds, smells, movements, and tactile experiences in art making can be soothing. It has the potential to improve cognitive and sensory motor functions and can provide a distraction from pain or illness. The physical act of making artwork produces tangible objects that are useful tools for reflection on a journey through treatment, which can help develop a person's understanding of themselves. The concreteness of a product of art therapy means that discussion can develop that can be returned to at a later date. To look back on a journey, notice developments, recognize achievements, and identify new meanings within the work. As mentioned earlier, art therapy is not concerned with therapists' analysis of images or the diagnostic interpretations. The artworks can be ambiguous, and interpretation is highly subjective. The important thing is for the service user to find their own meaning in what they have created. Art therapy is for anyone who feels it might benefit from a safe space to express their thoughts and feelings creatively, and this can be people of all ages and abilities. Service users don't need to have had any previous experience or expertise in art making, as it isn't concerned with artistic ability, so you don't need to have ever made art before to benefit from art psychotherapy. The materials are there to be used in any way the person likes, so they just need to be open to exploring art materials and trying something new. An art therapist's focus is not on how good someone is at art, but their involvement with the art making process, how they use the materials, how they view what they create, what it means to them and how they feel about it. How the artwork's made, the process of its creation, what's discovered, what obstacles arose and how these were overcome, and the way in which a person relates to their own artwork, these are all of primary interest to an art psychotherapist and can often be way more revealing or important than the finished artwork itself.